All right, and welcome to episode 9 of Modern Prescription. My name is Dr. Deepak Dugar. I'm a board-certified facial plastic surgeon in Beverly Hills.
And I'm Dr. Jeff Toll. I'm an internist here in Beverly Hills as well.
And the COVID king.
We're diagnosing a lot of COVID right now. We're really trying to protect. I think my new phase here is we need to actually check that people don't have it before we do stuff to allow things to reopen.
That's great.
Instead of just reactionary testing once people have symptoms.
Right.
I think that's the next phase here. Hopefully the technology catches up so we can do that more efficiently. But even now, we need to test before we do a big production, before we do a big open a warehouse.
Rather than waiting for someone to get sick. Yep. And we're going to talk today about nasal tips, how to breathe better from your nose right now from home without going to a doctor.
A lot of nose stuff today.
Yeah, we're going to cover a lot of nose stuff.
Everything people want to know about noses, how to breathe.
How to do a virtual consult.
What does cocaine do in your nose somehow?
Cocaine in the nose. Why and when did they use cocaine in the hospitals in the nose? Yeah. And why you should not today.
And then a fantastic guest today.
Yeah, fantastic guest, a female, strong, amazing physician. Dr. Pooja Kumar is going to talk to us about her journey as a female physician, a mother of 2, and how she's dealing with being a COVID queen in the hospital on the front lines, taking care of COVID patients every single day. We're super excited. Thank you for joining us today for episode 9 of Modern Prescription.
Enjoy.
All right, and welcome back to episode 9 of Modern Prescription. This episode's good.
It's a good one.
We're talking about a lot of different topics today that I'm excited to delve into.
Well, let's delve.
So, you came over last week to the office.
Yeah, this was actually my first time somehow in your office.
First time ever in my office.
First time in the office. We were there we were doing the doctor's new podcast.
Yeah, the doctor's new podcast with Dr. Mike Moreno. We were his guest. That was pretty cool.
Yeah, that was probably his best episode ever. To have us on.
Dr. Mike, if you're listening, we love you. You're amazing.
That was a great episode. And then I got to be amazed at what you do. I've always heard about what you do. I've heard your patients be happy. I've heard you tell me.
Yeah.
But to be there in person and to see what a consult is like. And so I didn't realize that there was all this kind of technology where you have even virtually. So, I guess you guys started doing this when you were closed, but having people send in photos from home and then explain, I guess, to us how you can go through the whole consult and kind of manipulate what the nose may look like and all this stuff.
Yeah. So plastic surgeons, we've always done virtual consults to some degree, but pandemic got us all 10 times better.
Right.
Like we're so good at virtual consults now versus before. Right. So, for anyone listening, if you ever thought about doing something plastic surgery wise, virtual consult is a great way to start because you don't even have to leave your house. Do it from the comfort of your living room, And so what we do is usually we will request you send certain types of photos. So we'll usually send them a grid of another person's photos so they can see exactly what we need for them to send us. They'll send us those photos, and then we have this basic information we have them fill out. Their name, their age, their address. Have they ever had any prior surgery? Do they have breathing problems? A couple of different questions. Then they send it to us. Then what we will do is we will do a virtual consult with them if it's online through Zoom. And I do it through my iPad so I can share my screen with them. And then on the iPad, I can show them their photos. We can analyze it together. I can draw on it, make sure I'm understanding what they like or don't like. Then I can use the morphing platform apps that we have nowadays.
That was what I thought was cool.
Yeah, so cool. And we can morph the nose and we can change the shape of the nose and actually show them mentally what I'm thinking. Because, a lot of people say, I want a subtle nose job. What does that mean? To 15 people, the word subtle means a different thing. Like there's no definition of subtle, right? And so when I show them what I mean by subtle, then they look at it and say, okay, that's what I meant too. Or they'll say, no, that's definitely not what I meant. And then they're out the door, rightfully so, because that's the whole goal is for the surgeon and patient to match their perceptions.
Well, you're one of the few surgeons that really lives by that and really will tell someone if you want a whole reconstruction,
go
may
elsewhere.
Not be the right person.
100%. I did consults this morning on Sunday morning. 6 consults, 4 of them I said no to.
Wow.
And, they're all kind of amazed that why are you even here on Sunday morning if you're not going to just take our money?
Right.
And I just won't do it. I only take noses that I think I'm going to get a home run with. And it's back to like that conversation we had on episode 5 or 6 where we talked about.
I'm sure the listeners remember exactly what episode.
They know exactly what I'm about to say. But yeah, it was the comment that I said that, I kind of have that in not a bad way. It's the confidence that doctors have where if I don't think I'm the best for this person, I shouldn't be in the room. Yeah. Like, so it's that rapper athlete confidence that sometimes we have. Because if I don't think I'm going to just kill this nose, I want nothing to do with it. And that's why the consultation experience is not just for the patient, it's for me. Morphing their photos is not just for the patient, it's for me. Because I'm literally doing the surgery in my head while I'm morphing and I'm saying, can I actually do that or not?
We didn't get a chance to morph mine. What would you do?
I would not change a thing. You're handsome. You're perfect.
Right, I agree.
I'll send you out the way.
Thank you.
I might even refund your consult fee.
Thank you. Just come to you for compliments. That's really the only reason I'm here.
Yeah. We'll talk about your hair more and get you going.
It is a good hair day today. Just at the beach.
You hit the beach yesterday.
The beach fixes it again.
All right. So back to last episode talking about beach hair. So you did not shower after the beach?
So I knew I was going to go to the beach on Saturday.
Yeah.
So I washed it Saturday morning to get rid of all, because if you go in the ocean when it's the natural grease, it'll just get all clumped together with the salt.
So you shampoo before.
Shampoo pre-beach, get some salt in there, and then we'll let the oil sort of build up over the week.
With the natural salts that are stuck in there.
Gotcha.
You shower, just no shampoo.
Correct. Shower. Yeah. I showered 1 to 2 times per day.
Yeah, just no shampoo.
Just only shampoo, usually like once a week.
Amazing. All right, I'm going to try it, and I'm going to report back to you guys. I'm going to take photos pre and post and do it before and after.
Well, you're going to be
the
very
Jeff
happy
Toll
about
technique.
It. Yeah. Going to get some curls for me. It's funny, the photos of me as a baby, I have like these thick curls everywhere.
Really? Oh my God. Yeah. Did your father have really thick hair too?
No, it makes no sense. No one else really has it. I haven't seen what the milkman looked like. No, I look exact. Me and my dad look like twins, but we have very different hair.
That's hilarious. That reminds me of this joke. One time, Michael Jordan was being interviewed, and they're like, "Hey, Michael, how'd you get so tall? Your dad's only this tall, and your mom's only this tall." And he made some sort of joke, just like you did. He's like, "Well, the milkman must have been really tall."
That's funny. Yeah.
Oh man. Yeah. Speaking of like the nasal stuff, so we get a lot of emails all the time about breathing. A lot of people are like, "I can't breathe. I can't breathe." Yeah. That obviously I can't assess virtually.
Right.
So what I want to do is I want to give everyone listening right now my tips and techniques on how to breathe better right now at home without doing anything, without going to a doctor.
I have a lot of Jewish allergic patients who can't breathe through their nose.
They can't breathe through their nose. Yeah.
What do we do?
All right.
I'm a victim myself.
So there's 2 main reasons that you can't breathe well through your nose. One is dryness. The second is allergies. Okay, allergies and dryness. Almost everyone has some degree of allergic response to something, right? Whether it's dogs, cats, dust mite, dander, pollen, something, If it's really bad, yes, you can go to an allergist, get worked up, find out what it is. You can do immunotherapy to get rid of it. But if it's just the normal type of allergy stuffiness that comes and goes, you can treat it by yourself. So the number one thing is dryness and allergies is number 2. So the biggest thing that helps is putting a ultrasonic cool mist humidifier by your bed at night. And don't put it in the room and humidify the room. You have to put it by your bed, about a foot away from your bed, and let it drop the cool mist on your nose, on your face while you sleep for 6 to 8 hours. 8 is what Dr. Toll prefers, 8 hours a night of your sleep. And if you do that every single night for 6 months, it will literally remodel the internal nasal tissues of your turbinates, which are the little balls inside, and your septal mucosa. It'll literally remodel it so that it becomes shrunken down because it doesn't need to swell up to warm, humidify, and moisten the air as much.
I want to play a game where I'm devil's advocate of every time.
Let's do it.
I give a patient advice and what do they respond?
Yes.
So, but doctor, if I have this humidifier, aren't you worried I'm going to get a lot of fungal stuff, fungus or mold in my nose?
Great question. You won't if you're using clean water.
Gotcha.
So the key is taking care of the humidifier and not having moldy, fungally water in there for months on end. Gotcha. So we recommend changing out the water in your humidifier once a week and using clean distilled water, preferably over tap water, so there's less mineral sediments that are potentially being particularized.
Is there such a thing as a chronic, a lot of people who have stuffiness or headaches, sinus headaches, can that be fungal or is it more likely really just allergies?
It could be fungal. So the most common fungal of the nose would be what's called allergic fungal sinusitis, AFS. That is very much more rare than what's typically called chronic sinusitis, which is usually bacterial in nature. But AFS, allergic fungal sinusitis, is common depending on the region you live in and based on the environment. So it's common in like the Midwest. It's common in the South, like in New Orleans, Louisiana, South Georgia, those areas. Allergic fungal sinusitis, but it's less common.
It's very trendy here. People complain about mold.
Mold, yeah. Trendy. That's a trendy. It's like
a trendy
oat milk
diagnosis.
lattes.
Yeah.
Yeah.
They get some mold with their lattes.
So number one,
so
humidifier.
Keep it wet.
Yeah, keep it wet inside the nose. Number two is using during the daytime any type of saline spray, ocean spray, so which is usually salt water that you can buy in a little bottle over the counter, cost a couple of bucks, and you just spritz your nose 5-6 times a day, just like literally having a nice little spritzer to keep the mucosa wet. So keeping your nose moist. And the alternative, another really easy, cheap thing, is using Vaseline inside the nose. A lot of people get nosebleeds, especially in summer. It's really dry and arid all across the country. And so by putting a little drop of Vaseline in the front of the nose, you can decrease the amount of dryness that your anterior septal, the front of your nose, is facing. So just like your hands get chafed and crack and look really, ashy, same thing's happening inside the tissues inside your nose too. So Vaseline, spritzing with nasal saline, like ocean or salt water, and then humidifier. Those things alone, this won't cost more than $10, $15, and literally can remodel your internal nasal anatomy so you can breathe better.
That's the whole thing.
That's the whole thing.
So what are those things? Say those quickly.
Humidifier, saline spray, and Vaseline. That's all you need to breathe better. Literally, by doing those things, you can change the way you breathe.
I have all those in my earthquake kit. So we're ready to go.
Yeah, episode 8, we talked about what you need in that earthquake kit. So good. But that's the moral of virtual consults. So if someone emails me, we literally have a template. We just send it back to them.
That's very helpful because a lot of times, that's one of the common things, people will ask me about, and I don't always have great answers. So we'll try. When do you jump from that to more aggressive? So things like
number 2 step would be nasal steroid sprays and antihistamine pills. And that's step 2. And then step 3 would be surgery.
Nasal antihistamine sprays. So things like azolastine, do those help?
Love it. So that's a special one. That one's not your typical steroid. So the old school one that's been around forever is just topical nasal cortisone.
Like Nasacort,
Nasonex, Flonase. Yeah. These are just literally fluticasone is the medication. And it's just an oral topical steroid. The reason I love those is because they did studies and they did 25-year studies, and they showed that there was no systemic absorption. It just worked topically. Just like the way if you put cortisone cream on your hand for a rash, it doesn't get absorbed in your body. Right. It's not going to stunt your growth. It's not like taking steroids, HGH, which we talked about on episode 6. It's just topical. And so I love the topical nasal steroid sprays because what they're doing is they are keeping the inflammatory reaction of the turbinates down. And by keeping that reaction down, you prevent the turbinates from swelling up when it's presented the allergen, such as the pollen, the dust, the dander. And I think that's the key, is using those. But the other mistake that people have is they think that they can squirt it in their nose once in a while and it'll help. It doesn't. This is a continued slow effect of using steroids chronically, topically. So it doesn't get absorbed in the body, so don't worry, it's not going to stunt your growth, but you have to use it over and over and over.
I think there's many diagnoses like this where there's a chronic low dose of steroid that's supposed to help you long-term feel better. Same thing with asthma, same thing where people... Same thing with asthma. They like the albuterol because it works like immediately. You take it and you feel better. And for the nose, people a lot of times will use something like Afrin.
Oh, Afrin's terrible.
But I hate Afrin.
No, Afrin's terrible. I got to talk about that in a second. Yeah,
because and that was the point I was trying to get to, is there's things that work immediately.
Yes.
But a lot of those have rebound terrible effects.
Yes.
Which I'm sure is what you're going to get into.
Yes.
But also just don't work as well in general long term.
No.
Whereas these others are maintenance things to make you more... it gets you back to a normal baseline or better than normal baseline.
Yep.
Where you won't need to reach for something like Afrin.
Exactly. Right. And I use the example always with my patients of a 6-pack. So if you go to the gym and you do 100 crunches today, and then tomorrow morning you pull your shirt up and you look in the mirror, you're not going to have a 6-pack. But if you go to the gym and you do 100 crunches every day for the next 6 months and don't skip a single day, I guarantee when you pull your shirt up, it'll look better than it does today. You may not have a 6-pack, but it'll look better. Yeah. And that's the moral of the story with any nasal hygiene or anything really. Yeah. But back to what you're saying. So Afrin, terrible. If you're listening, throw it away. If you have it in your house and you use it, throw it away. Afrin is the worst thing. And the reason is, Afrin is so powerful. Oxymetazoline is the name of the medication. Yeah. It literally shrinks all the tissues in the nose.
It's a vasoconstrictor.
Vasoconstrictor, so it shrinks them. The problem is your body gets so used to it. So what we found, the studies have showed, if you use it more than 3 days in a row, if you use it consistently more than 3 days in a row, your body gets what's called rebound congestion hypertrophy, where your nasal tissues now swell up more than they used to because they are swelling up in response to the vasoconstriction that they are anticipating they will get. Right. And if you don't use the Afrin again, the tissues just stay puffy and swollen. And it can literally create a long-term, lifelong remodeling of the tissues where it never goes back to normal and you can never breathe again from your nose. It's that bad.
It's really that bad.
Yeah, and we've seen so many nightmare scenarios where people have destroyed their nasal breathing because they kept using Afrin.
There are very rare times I'll recommend people use it. One, tell me if this makes sense, because I've told people this in the past and I've done it personally. So I'm one of those who has like
when you have a cold,
Jewish allergies. I'm stuffy a lot.
Yeah.
And so sometimes when I fly, my sinuses will hurt and I'll get a sinus headache. I have found if I like 30 minutes before takeoff, spray an Afrin.
Totally fine.
I don't own Afrin that I use frequently. That's like a one special case.
100% okay with that. I approve.
Or if someone's having a nosebleed, for example,
100%,
that's another special case.
100%, yes.
So I've had recently, actually, I had an older guy, maybe in his late 80s, who's on some blood thinners and aspirin, who doesn't drive and was having a heavy nosebleed, and he probably needed to see an ENT. But in the meantime,
Afrin.
So
that's okay too.
His neighbor,
agreed.
Afrin.
Agreed. Okay, so Afrin is okay. I'm not saying it's not. What it's not okay for is to be used as a daily medicine. Exactly. It is a rescue medication, much akin to albuterol for asthma.
Exactly.
If you're using albuterol every day, then you need to go see a doctor.
I have a lot, and that's another one where people think they're controlling their asthma because every time they start wheezing, they'll use the albuterol
and they think they're
feel
fine.
better.
Yes.
They think they're fine, but they don't realize that
you're not treating the disease.
Right.
You're just treating the symptoms.
Correct. And so some of them are lucky and they never get a really bad exacerbation. But if you're someone who's using a rescue inhaler multiple times a day, you're a setup for example, COVID or some other infection. When you get an actual bronchitis or infection, you will have bronchoconstriction that we can't turn around with. Even if we give you IV steroids and breathing treatments, that it won't turn around fast enough.
Right. And that's what's scary.
And that can be life-threatening.
Exactly. So the key is rescue medications are meant for rescue. Yes. They're not meant for daily use. Right. So Afrin, albuterol, these are not daily medications. And again, Afrin's okay before you get on a flight, if you're having a nosebleed, even if you have a sinus infection and your nose is just so congested and you use it for a couple of days, fine. Yeah. But don't use it more than 3 days in a row. Right. That is abnormal. Right. So that's my tips for nasal home hygiene.
The ENTs put a lot of funny things in the nose.
They do.
When I was a medical student, I don't know if this is a real thing. I think they were using cocaine during surgery.
That we still use that today. Some surgeons, I don't, but a lot of surgeons do.
What's the difference? Because I know this is an interesting thing. Everyone's heard of like lidocaine.
Yes.
All the canes are these anesthetics that are topical anesthetics.
Yes.
And so my understanding is that cocaine was actually the first topical anesthetic.
Yes, because it makes everything go numb.
Users will experience some numbness if they put it in their mouth or nose.
Yes. And so in the nose, so it used to literally be in the hospitals in the 60s, 70s, you would order cocaine and they would literally deliver you 1 gram or 2 grams or whatever it is, a little vials of the cocaine. And then you'd put a couple of drops of water in it to make it aqueous. And then you would put it on a Q-tip and they would paint the nose. And by painting the inside of the nose, the entire nose would go numb. And the patient's asleep under anesthesia, so they don't really get the high that they would normally have felt. So they skip that high phase and they just get the vasoconstriction.
Right.
So the tissues are completely vasoconstricted. Blood loss is way less. The amount of bleeding is way less. Surgery is so much smoother. You just paint everything with cocaine. What happened was all of a sudden, cocaine was missing. Left and right.
That's a big problem.
Left and right. Not being used on patients.
Those surgeons get up very early in the morning.
And they're tired, I guess, some of them. But and this became a thing, like across the country. So they stopped. Cocaine's hard to get now. As it should be.
In your residency, so when I was a medical student, like I was saying, I was at Jefferson, and they have a really fancy ENT
huge ENT program. Yeah. And the chairman just retired recently. He was super famous.
And actually, a buddy of mine who did his residency there is actually starting his fellowship in facial plastics here.
Wow, amazing.
Under, Azizadeh and Nassif. Yeah.
Oh, cool. What's
so
I think he
Dr.
emailed
Nick
me.
Helm, maybe you met him.
I think he emailed me.
Okay, so he was a buddy
to shout at me. He emailed me to shout at me. Yeah, cool.
I'll introduce you guys.
Yeah, maybe we'll have him on the pod to talk about his fellowship.
And when they used to do these, did you guys do these like flap massive surgeries?
Huge, massive surgeries.
It's so cool to think about that. Now you do these little delicate.
I know.
And during residency, you were probably doing these
we were taking shoulders. We would take the bone and muscle from your shoulder and use it to reconstruct the jaw.
Wow.
Because someone would have cancer that eats up their jaw. So that cancer, to get the cancer out of the jaw would take us like 4 or 5 hours, maybe 3 hours. You would have to
saw off the bone.
Yeah, so we use a saw, we cut through all the soft tissue, we go around the nerves, try to preserve as much nerve as we can, remove the actual bone with the cancer in it, get it out. Now you have this huge hole in the patient's face. You can't just leave it there. So then what we do is what's called free flap reconstruction, where then we would take either the fibula from the leg, or we'll take clavicle, or we'll take scapula bone from the back, take the bone with the muscle and the blood vessels, and then we carve it to shape so it fits properly, stick it in their face, reconstruct it all, connect the blood vessels through microanastomoses with 9 little tiny sutures under a microscope you can't even see, and then put them in the ICU, pray to God for 7 days that the tissues take and no rejection happens, the blood vessels don't clot. And then all of a sudden it heals really well if it all goes well.
Unbelievable.
And it's unbelievable. And these people live 10, 20, 40, 50 years sometimes, and they get to continue life. And now their back is in their face.
They have a back in their face and a lesson not to use chewing tobacco.
No chewing tobacco. Oh my God. Right? Yeah,
that's
say that again.
That's where most of these squamous cell cancers in the mouth come from.
Yes, chewing tobacco. It's because of duration. It's not just the effect of it. It's that it sits there and then it literally, as it sits there, you're increasing the duration exposure time. Mm-hmm. Versus when you smoke, you get this instant hit that clears instantly, right? It's a one-time hit. Versus chewing tobacco, it's like sitting on someone's head.
Right.
You're going to choke to death. You're going to die if you sit on someone's head for too long. And so same thing with chewing tobacco, it just sits there and the cancer risk goes up every second it's sitting there. And sometimes these guys sit there for years. They go to sleep with it in their mouth and they wake up in the morning and put a fresh dose in.
Yeah. It used to be so common in baseball. Most of the players use it.
And then they switched to chewing gum, right?
I think most of them switched.
Yeah.
I think there's still players that use it, but not the same.
Real tobacco. Yeah, not the same. Smoking's terrible. If you smoke, the one thing is, I don't know if you said this or Dr. Mike said this last podcast we did, but just always be quitting. And I thought that was such great advice.
Yeah.
Because it's just true. If you're a smoker, it's okay. You're a smoker, but just always try to be quitting. Don't be a smoker who just loves to smoke and never wants to quit.
I think COVID has been a really great opportunity to get a lot of my smokers to quit.
That's amazing.
A lot of them.
Because socially, they're not pressured.
Well, I think they are scared.
Yeah. From the lungs.
Yeah, from the lungs.
Smart.
So I think it's been a unique, it's still hard. I mean, it's such a, for lack of a better word, mind fuck, all getting off any of these things.
Right.
Because your body wants it so bad.
Yeah, you're addicted to it once you have it.
You're very addicted.
Yeah, and that's a good point.
So, it's interesting because people are anxious and a lot of people reach for a cigarette when they're anxious.
Yeah.
But at the same time, because at least when COVID started, the whole thing was about the lungs. What does it do to the lungs?
Right.
That people are really wanting to quit.
So I saw a study actually that said vaping, and I want to get your thought on this, has people who vape had a 6 to 7 times more likely risk of getting COVID.
Of just getting it.
Of getting it. And so and I think it's correlations. I want to hear your thoughts.
Well, my correlation may not even be the real one. Mm-hmm. My sense, if they're vaping, like we're talking about,
like those,
Juul,
Juul, those cartridges, like.
So people who are vaping share their vapes. And if they're young and at a party, they will be handing each other
Passing
vapes,
around the Juul. Yeah, got it.
If I had to give you a reason why they're more likely to get it, we're not talking about have it worse, die from it.
No, I'm not saying any of that.
If we're saying just purely get it, that's my connection.
Yeah, I think that's probably a really valid one. It's probably just riskier behavior in general. People who vape are probably a little bit riskier than people who don't vape. If you just look at average behavior.
That's probably true too.
Yeah, so it's behavioral pattern. But I don't think the vaping itself is causing.
Well, if you're sharing a thing with your saliva on it,
that of course. Yeah. So risky behavior. Yeah, because if you're gonna vape, don't share your vape. Stick it in your pocket.
Exactly. No, they all share.
Yeah.
Yeah.
But it's the anxiety, like you said. Yeah. And so another cool thing that you were telling me earlier, you saw a study where they have robots for elderly.
Yeah. So, one of the things I've been mentioning the last few weeks was that a lot of my elderly patients, it's like really, really becoming a struggle to be so isolated.
Yeah.
You know, a lot of they're scared to see their kids and grandkids because of COVID. You know, they're between 70s to 80s, let's say.
Yeah.
And a lot of you know, need company.
Yeah.
And so I saw, you know, this is silly, but a thing about these robotic pets like dogs, and they look like cute. They look exactly like a dog.
Yeah.
But you don't have to, you know, obviously clean up their poop. So it may be easier.
And worry about their livelihood.
Right.
Yeah. No, I think that's so cute. And it's like what we talked about last episode, call your grandparents, because, you know, there's a lot of social anxiety and isolation right now. And I think no matter how bad you're feeling it, somebody you know is feeling it worse than you. Yeah. Somebody's feeling it worse.
I'll point out my mom was very upset when I told people to call people's grandparents, that we didn't tell people to call their parents also.
Definitely call your mother. Definitely call your mother.
Yeah, so
literally push pause right now. Just push pause. We won't get our feelings hurt. Come back to us in a minute. Call your mom right now.
Mom, you hear I listened to you for once. There you go.
You're such a good Jewish boy.
There you go. I'm actually about to see her now. We're having a barbecue.
Oh, that's
outdoors, socially distant.
Amazing. You know, I think it's okay to do socializing with family and friends if you are responsible. Wear a mask.
So my mom and her husband will sit at a slightly separate table from the less risky people, but have masks on other than when we're eating.
Yeah, that's so smart. I love that. Today we have a cool guest because we have Dr. Pooja Kumar, is a really good friend of mine who's also an internist like yourself, but she's mostly a hospitalist, works in the hospital, versus you are a combination, mostly outpatient. Yeah, but you do both. You do both. And so it's interesting to see someone who mostly just does inpatient hospitalist, and to hear her experience as a female doctor and what she's, you know, the challenges she faces as a female that me and you don't necessarily face.
It's not easy to be a woman in any field, but medicine is a difficult one.
One. And we will allude to this later, but we don't talk about the struggles that women have in medicine ever.
It's one of the ones we haven't gotten to yet.
Yeah, it's just no one talks about it. Like it's totally under the rug. Even during the whole Me Too movement, it never hit about hospitals. And it's funny because in our residency, like if you think back to our memories, there was so much sexism.
So much.
So much.
Yeah.
And, you know, I don't know how it was in internal medicine and surgery.
Oh, yeah.
It's crazy how they would abuse and just marginalize the women during the residency programs. And it's just accepted. And you know, there's this movie I just watched this weekend with my wife. It's a Bollywood movie that my wife loves Bollywood. Yep. She's hugely into it. And so, so am I actually. But it was a movie about the first Air Force pilot who was a woman in India. Okay. And that showed her struggles. And one of the things was she kept getting pushed around. And their argument was, listen, there's no room for weakness. It's not about being a man or a woman. It's about being able to handle it. And so they tried to punch her or something, did some sort of thing. And she obviously fell to the floor, right? And so that's why you can't be in the Air Force. And then the point that she made, and the reason the movie was so good, is that she realized that, okay, I see your point. I will be strong enough to do it. And then she got strong enough to do the things that the men could do. And then everyone realized, holy shit, we were wrong. Yep. Because I feel like as men, we judge women on things that we find ourselves strong in. And you don't realize that they have so many strengths that we don't even have. Yes. There's ways that we can't even judge them because we don't even know.
I'll admit it freely.
Way better. Me too. I'm with you. Yeah. Way better.
At most things.
I think at almost everything. I don't know, being married, you being in a relationship with your mother, your friends, your family, we see the powerful women in our lives and what they're able to achieve despite what they have to go through. It's amazing. And guys, surgeons especially, I just read this really disturbing article came out. There's a neurosurgeon, I think in Alabama, and he is a full-fledged neurosurgeon at a hospital. Took a female med student, for a joyride in his super fancy sports car, like a Spider, something really stupid fast.
Very douchey.
And he was going 150 miles an hour, crashed the car. She died instantly. The female medical student died instantly. He's alive, unharmed. God. He's now potentially going to be prosecuted for involuntary manslaughter.
Wow.
And
deservedly so.
Deservedly so. I mean, that's the stereotypical, in my opinion, of the male chauvinistic, I'm better than you. I can do whatever I want. Let me show you. Look how powerful my life is. Yeah. Come here, little med student who's a girl, and sit in my car, and I'm going to show you how cool my life is. Terrible. Just terrible. I feel so bad for her and her family.
Unbelievable.
Yeah. But it's just another showcase example of the chauvinism that continues.
Yeah, no, it's all, I mean, I have seen it many times very clearly in every way, from the older, attendings down to the med students, from co-residents of the same class in every way.
Right. Yeah. So I'm excited. We're going to talk to Pooja Kumar today and understand Doctor's perspective as a female doctor and her journey. And so it gives us a little insight as male physicians to understand a little bit more about the female perspective.
Excited.
All right. And we are back with our very special, amazing female doctor, super powerhouse, mother of two, Dr. Pooja Kumar.
Hello.
Welcome.
Hi guys.
Welcome.
Thanks for having me.
Thank you for being here.
I'm excited.
So tell us a little bit about yourself. Tell us what you do, and we can't wait to dissect your brain and understand the challenges you face every day as a mother of two and as a female physician fighting COVID on the front lines every day.
Wow, thanks. So I grew up here right outside of here in Palos Verdes, and I grew up with my family, and my dad is actually still a practicing internal medicine and pulmonary critical care doctor. So I sort of grew up in his shadows. In his office, I would be the one doing the files on the weekends, and in the summers, he would get me an internship in the emergency rooms doing EKGs, just sitting there, soaking it all in. And then I left for school and I lived in New York. And then I came straight out of residency to join him.
Wow. Yeah. Join your father.
So did your dad kind of ask you or force you to be a doctor, or you wanted to be yourself?
So he did not. I wanted to from a young age. And actually, so my sister, I always struggled with chemistry and biology. I was getting tutors on the side, just to get, an A-. And my sister wouldn't study for it, and she would ace the exam, set the curve. So he was kind of hey, maybe you should do it. And she can't stand the sight of blood. She would do the same, she's a couple years younger. She would do the same job that I would do, in little internships or whatever we did in the office. She would call my mom within an hour being pick me up. I saw a drop of blood.
Wow.
Yeah. So and then my mom actually begged me not to do it.
Why?
Really?
Yeah, because she grew up she raised her family with a husband that was an ICU doctor who took his own phone calls, which he still does actually every single night. So being woken up every hour. And she was don't do, because that's her, her what she knows of what a doctor's life is.
And she didn't you want you to have that stress?
She's I don't want you to wake up every hour answering the phone call or having to, go in at 1:00 in the morning for a sick patient, because he runs his own practice.
So how do you balance that? Because there's so many young girls who, are at that precipice of deciding, do I become a nurse? Do I become a doctor? Do I, so many people, and a lot of them have that same fear that mentality of stress, strain. What would you guide them, or how did you decide?
So funny, because people ask me that all the time. I have two, little girls, 2 and 4 years old. And so people ask me all the time, and I would say, you just kind of have to tell them that it is a busy life. And so, there's certain personalities that can handle that, and there's certain personalities that can't. But, there's ways to set it up. You don't always, in this day and age, we have so much advances in medicine, and these hospital groups and everything, has become so corporate, which in a way has helped, because there are ways you can dictate your own hours, your own time, how much you want to put into it, how much you don't want to put into it. It's not a field that always has to take all of you at all times. So I say go for it. If you love it and you want to do it, go for it.
And so for the listeners, tell them, I understand that you're you're an internist, but you do a lot of hospital medicine. So can you explain what that means, and what does that mean in terms of seeing patients with COVID, and how has that changed your practice this year?
Of course, yes. So being an internal medicine hospitalist means that when somebody goes into the emergency room and they're sick, and the emergency room decides that patient is sick enough to stay in the hospital, you get assigned to certain doctors based on insurance, no insurance, and that's to put it simply. And so I am one of the doctors that they get assigned to. So I see patients in the ICU down to not in the ICU, and who are just there for maybe an overnight observation stay. COVID has changed us. I mean, it's black and white. It's a different world in there now. One, we are all masked up at all times. Depending on the resources the hospital has, patients who are suspected COVID, we call them patients of interest or of suspect, and patients who possibly do have COVID or who do have COVID are on specialized units. They're on isolation beds, and everyone's gowned up, and it's just changed what kind of tests we can order for them, what kind of procedures we can do for them.
What, as a mother of two who spends a lot of time with your parents who are older, you're worrying on all ends of the spectrum, right? You're worrying about your young children, you're worrying about your older parents, and every day you show up to this environment where COVID is everywhere. Like in my office, there's no COVID.
Right.
Like we don't, if you even have suspect of COVID, you're not allowed to enter.
Yeah.
Versus your office is like, if you suspect COVID, please come.
Right.
So how do you balance that stress level of,
Yeah, I mean, there's sleepless nights for sure, and we're getting used to it. But, again, even with my father, who is absolutely at what we had initially thought was a high risk, he's over 60, he has other, mild but medical illnesses. And so we just take it one step at a time. We make sure we're really protected. We are, in ways better suited than our colleagues that are in the emergency room or on the emergency response teams, because we do get that benefit of time. So we make sure that we demand our proper PPE. So if there's no N95, we're not going in. And so in a way, we actually at this point feel more protected at work sometimes than going out into the regular environment. But definitely there are moments, where you have a little bit of a headache and you think, oh, here we go. I got it. Or especially sometimes there's patients that test positive for the virus after they've been there for a while. And so those are the tricky ones, because you always, second guess yourself. Like, did I touch them and then not wash my hands, or,
I think that's a really important point that you're making, that despite the fact that you're seeing COVID patients that have it, because you're masked up and gowned up and wearing protective equipment, you actually feel safer at work than, being in a supermarket or somewhere else. Because a lot of, there are way too many people out there who still don't believe in masks or don't wear masks. And that's really what's driving this whole process. And
absolutely,
it's hard to get across that doctors have no vested interest in making up the fact that masks work. They work. They do work. Yeah.
I don't know about you guys, but I'll get at least a text or two, a couple texts a week from friends being like, so do you believe this? Like, do I really have to wear a mask? And I'll send them, I have this one, selfie, me all masked and gowned up. And I'm like, yes, it does. Here you go.
And it's great advice, because I always say, we've all been working, you guys have been working through the pandemic, both of you taking care of COVID patients.
Right.
I've been working now 3 months. I, knock on wood, haven't gotten COVID, right? Have you gotten COVID?
I have not.
Okay.
Nope, not yet.
Dr. Toll has gotten COVID. He got it early on.
You
I
had
had it before we knew about, before we realized that we need to be gowned up and protected. So maybe the first week of March, I had a patient in my office. So I didn't have an N95 or goggles or anything.
Yeah, there's no way to test even back then.
No, we didn't have tests for it.
Right.
But I didn't have the equipment that now I wear on a routine. Now in my office, just seeing a regular visit, I'm still masked up and have a face shield on.
Right.
And it works.
Yeah.
And it works.
And it works. Since 3 months, we've been going to work, seeing tons of patients, and we're not sick. It's because we're wearing masks.
And unfortunately, it took us a while to figure that out, and the hospitals have gone so up and down and back and forth with this. And because there was a shortage of PPE to begin with, there were some nurses that were reprimanded if they wore N95s. And that was really so sad to see, because then you saw so many of healthcare workers getting the virus, and because of the high viral load that they're getting exposed to, not doing so well or getting their family members sick. And then, 2 weeks later, you get a memo saying, oh, yes, everybody should be wearing N95s if you're in a COVID suspected area.
Right.
So it's been tricky.
I think the whole mask, don't wear a mask thing, is kind of like the birther thing. Was Obama born here? Now they're trying to do it with Kamala Harris, right? Is she born here?
Is she born? Yeah.
But I think it's like the masking and the birthing theories are the exact same.
Yeah, it's just
they enter a little bit into your subconscious of is there actually a thing? And then it makes us all question it. And it's nonsense.
It's nonsense.
Wear a mask. And Kamala Harris was born in Oakland. It's very simple.
I mean, just do it. Like,
yeah.
I think also people don't realize, like, we want it over. I'm sure, like, I don't want to wear, I took the I was literally at the hospital an hour ago, and I came in here, like, sweating because I'm trying to stay active, because we all want to stay active and healthy, and I'm trying to take the stairs in an N95. Like, I don't want to either.
Yeah.
So just wear a mask.
How do you feel as a young Indian female doctor with a potential half Indian vice president? Tell me your thoughts.
We are dancing. We are so excited. What I'm really excited about is for my daughters to be able to, because my daughters, I'm married to an Indian man, and my girls, they've got long, thick, dark black hair, and their skin is the color of mine. They get even darker in the summertime, and they're at the beach all day. And for them to look up and see, our vice president hopefully is, half Indian, like, that's exciting. You see pictures of her mother in a sari, and know that we wear saris to weddings. Like, how great and exciting for them to even realize that this is an opportunity for them, because I didn't have that at all.
Right.
We're just excited. We're really excited.
In your medical journey, did you ever face, or did you ever feel, because you have two identities, right? You're ethnic, being Indian and going through the medical journey, but that's kind of like a superhero thing. It's like being Jewish or Indian in medical. It's kind of like,
they're like, welcome.
It's an advantage.
Like, you're supposed to do this, right?
But being a female in medicine definitely has some challenges. We can attest as male physicians, you guys have it way harder than we do.
It's interesting. And then take that to another level and be the daughter of a senior, almost in he's been working at the same hospitals for, I guess, almost 40 years now.
Wow, that's legendary.
And so there's it's challenging, and it's challenging to be taken seriously. I think
tell us what you said earlier. You said that you have to wear a white coat.
I have to wear a white coat. And funny enough, my dad, he didn't directly tell me, but it was a day that I spent shadowing him. I spent, he's old school, right? So I spent half a day shadowing him. And then he was like, that's how it works. I'll give you your list of patients tomorrow. And I was like, wait, what? But so I spent half a day shadowing him, and I didn't. I wore like black slacks and, a sweater or something. And people kept bumping into me, asking to take my chair, asking what I was doing there. And he said to me at the end, he goes, did you order a white coat? I was like, yeah, I have one coming. He's like, okay. And, it was a silent moment. But yes, a lot of us female in the healthcare industry and workers, we prefer to wear the white coat, because then nobody can comment on what we're wearing, comment on our bodies, judge us on our bodies, ask us how old we are, ask us why we're wearing that. And it just, for us, it takes away so much of the complication. And then I can wear my badge that says MD, and I'll turn it so that it says MD instead of my name, so that people actually will speak to me when I want to.
Wow.
Yeah. That's so difficult. I think a lot of times, when, at least for me, if I walk into a hospital room, the patient looks at me and they think, oh, this must be the attending doctor here.
Right.
And I know friends that are, amazingly brilliant, dedicated physicians, female physicians, where the patients will call them nurse. Hey, you'll walk into a room to examine them, and
hold on, my nurse is here.
They'll ask you like, oh, hey, can you bring me some pudding, or like ask for water, something they would never ask the male doctor to
do. Yeah.
Have you experienced that too?
Every day.
Wow.
Just this afternoon. Like on the phone, and I'm like, should I come back? Is this an important phone call? And oh, nurse, no, can you just give me another pillow? I'm like, no, I'm your doctor. I'm here to talk about, why you need emergency surgery in 4 hours. So please hang up. And and it's challenging. I think we as women learn how to be patient with it. And in a way, kill them with your kindness or kill them with your smarts. And so take care of them. And then once you do, you take care of them, or once they realize you're in charge of the orders, the next time you walk in, it's like, hi, doctor, how are you?
That's great advice.
So, but it's challenging, even being taken seriously by emergency room. When you walk down in there and you're looking for your patients, who are you? What are you doing down here? Whereas I kid you not, when my dad walks down there, it's like, Dr. Kumar, can I get you a cup of coffee?
Wow.
I'm like, I need coffee.
Because it's interesting, in the last couple of years, there's been such a spotlight on this in all the other fields. So like in entertainment, in all these other fields where
Me Too.
The whole Me Too movement.
Yeah, the whole Me Too movement.
But medicine is very paternalistic in general. So both the way that old school doctors talk to the patients, like sometimes like children, or tell them what they're not shared decision making. It's like, this is what you're going to do.
Yeah.
And then there's an equal amount of, I think, sexism and like inappropriate, how some doctors or surgeons talk to their nurses or talk to their assistant or
other female doctors.
Every day. The residents, how they talk to them.
Oh my goodness. Funny enough, so my husband's an attorney, and he always, to this day, he's always like, you could do a show on this. You could just tell stories. You could write a book about this. Because I would always, through residency, come and tell him all the stories. And it happens all the time.
Tell us a ridiculous one.
Oh my goodness. Okay, so no names, but my very first week working with my dad, so I walk into one of the hospitals and a surgeon says to me, "Are you married?" And I said, "Yeah." And sometimes I wear my band, sometimes I don't, we're wearing gloves all day.
Yeah, hand washing.
And I said, "Yeah, of course, I am married." And he says, "Well, how much did your dad have to pay to get you married?" And I said, excuse me. So this was kind of racist and just something totally inappropriate, sexist. Yeah. Don't say that to somebody who's your colleague who you don't know. And I said, "Excuse me?"
Wow.
And then so went on and he sort of starts smiling. So I think maybe you're joking. So I said, I chose to get married, and if anything, and then I, being a smart ass, was like, if anything, he had to pay to marry me. And,
I love it.
And he goes, no, like really? And in your culture, don't they have to pay for you to get married? And so I sort of walked away, and then I called my dad, actually, funny enough, and this goes back to sort of this paternalistic anything goes in medicine. And I said, "Dad, this doctor, Dad, what is this place? I'm out of here." And he goes, please don't. Like, he's a surgeon. We need him. He's a good surgeon. Just don't. He's kind of cuckoo crazy. Just deal with it.
You just deal with it.
It's just so funny.
And that happens at every hospital. So I'm at Cedars-Sinai. It's one of the biggest hospitals in the U.S. And there are certainly, I won't name them, but a few surgeons who get away with behavioral things. We're definitely not naming them.
I don't work at Cedars. I'm happy to name them.
Thanks, Deepak. We're gonna, we'll need a job next week.
When some of these very specific things, like there's certain subspecialists or surgeons that it's very difficult to replace them because they have a technical skill that can't be matched or found. You cannot.
And there's only 6 of them in the country.
There's 6 of them in the world. They literally can't be replaced, and so they get away with a lot of stuff.
Oh yeah,
like the guy who takes out gallbladders from the left. It's like he's the only guy who can do that.
Right. And so that same type of thing was the way that a lot of people in entertainment got away with it for all these years.
Because they're who else could package those deals? Yeah. Harvey Weinstein got away because he was a master at packaging. No one could do what he could do.
Right.
And yet the world's us, better without him.
We're a little bit lower income, population. And so to get people when, Cedars is 10 miles away to want to come and work at hospitals like this, you sort of, once you get them, you want to keep them. So you sort of it is an environment of really anything goes.
Right. And that's a great point you just brought up, because a lot of people always think about I want the best care possible, right? And so what people don't realize is that doctors are standardized across the country for more or less most things.
Right.
So, everyone's thinking oh, wow, Cedars, UCLA, but any community hospital has great, amazing physicians in it. And it's just about the culture that's pervasive everywhere, and that's the cool thing about medicine. No matter where you go, it's a common language. We talk to friends and colleagues. I was on the phone yesterday with a doctor friend in Brazil.
Yeah.
And literally, it doesn't matter where in the world you are, our profession connects you on a level because you just understand things no matter where you are.
And I think it's, it's understanding resources. So I called Cedars, it was a busy day, but I called Cedars this morning and, talked to Transfer Center about, understanding the limitations of where I work and knowing that 10 miles away is a hospital that can handle it and, and not having competition. I wish that there was a little bit more of that, understanding what we're all capable of and being nice to each other.
Right. Rather than looking like you're dumping
And I think in your
patients.
industry, everyone really is. I imagine there's a lot of competition, but it feels like you guys also have the ability to have good dialogue with each other.
I think so. I think it's kind of like, it's just the relationships, like you said. So within the hospital, within the private communities, having those relationships. But I think as the male doctors, every listener, any male listening needs to understand that women in all industries always have a little bit more of a struggle.
Absolutely.
And we have to do our duty to not just ignore it, because ignoring it's just as bad as taking part, I think, but to be actively vocal about it. And in my practice, so you guys know I work with my wife, and she's the anesthesiologist in my practice. Yeah. I make a point, because a lot of times I'll notice when I walk in the room, the staff will even be like, oh, hey, doctor, hi, doctor. They just use the word doctor. Yeah. And my wife walks in, hey, Pooja. And so I've made it a rule, like, no, everyone has to refer to her as doctor. Absolutely. Even some of the girls are like friends with her. And I say, nope, you have to call her doctor.
And that's funny. And my dad does that too. Yeah. So he'll be at the hospital and they'll say, oh, well, Pooja just ordered, potassium on this patient. You don't need to. And he'll say, no, she's Dr. Pooja. You know, and he because and also for us, and one thing I do want to clear up for the listeners, we're not, women who are doctors are not on ego trips. You don't need to call me.
You don't sound. You want to be equal, and you want the respect from
absolutely.
The patients.
So you can give them the best care.
Yes, and I feel like sometimes it sounds like women are on an ego trip, but in fact it's just a matter of there are times where, and you guys are in the same boat as me, is we have to give orders because someone's livelihood or somebody's life is dependent on it, and so I want you to take me seriously. And so if you're going to call the man sitting next to me doctor and me by my first name, it kind of makes me feel like you're not taking me as seriously. And then I get worried that you're not going to fulfill what I've asked you to do. And you may not understand how important it is.
Right.
And so we always say, call me doctor. Call me whatever you want, but just call me doctor so I know we're on the same page.
Right. And that you understand that this is a relationship based on me giving you things to help you.
Yeah. Absolutely. But it still happens all the time. Like I'll walk in and need to, use a computer, and my dad will walk in literally 1 minute after me, get up, even take the little little Lysol cancer causing wipe and wipe down the computer for him, and I'm still standing being like, hello, can I use that? So we're getting there. I think you're seeing women standing up more, stronger.
Yeah,
really
important.
I found there's a lot of really strong doctors on social media that are helping to kind of give awareness to how smart and strong some of these women are. So I think before that, there was never a light shined on this issue because it's in the hospital. Like we know it in the hospital.
Right.
The TV shows showed a little bit ER or whatever, but not really, not in the same. They didn't see it as much. And so now I think
it's really great.
Yeah.
The one thing about the social media and the doctors, and so I practice traditional Western internal medicine. I see really sick people in the hospital, and so I tend to notice that the social media presence is a lot of women doctors, and I feel like they're forced into also talking about beauty and makeup and what do I do in a day, or weight, or
they kind of
things
become a blogger.
And I was talking to a friend of mine who's also a doctor at Cedars, and we were talking about how for us my life is really, just traditional medicine. Yes, I'm a woman and I love all of that other stuff, but what do I practice? Where is my knowledge? It's internal medicine. Mm-hmm. So it's I'm not sure if that's us just kind of blending our work life, or if it's sort of, we know that if we start talking about makeup and how we keep slim and what we do, that'll get more listeners, as opposed to seeing a woman just talking about pneumonia.
Well, I think it's both. It humanizes. I think even people who are, a celebrity from, an actor or something else, people like to know who they are. I think that's why social media is cool. And so, to get a little bit of the personal life. So whether it's talking about beauty or some other hobby you like or something, people want to know you.
People want to know,
Right.
Yeah, your normal life. Yeah, and my patients love it when I talk about. They're like, "How are your kids?" I'm like, "Oh, they're monsters." They're like, "Oh, tell me more. Tell me more." As opposed to no, they're little angels.
Well, tell us. That's the last thing I want to ask you. So, what are you going to do about school? as a young mom who's
a lot of listeners have been asking.
I know.
Yeah, that's a big topic.
So my daughters are 2, almost 3, and 4, almost 5. So my older daughter is more what the question would be geared towards. So she still has a year before she would start kindergarten.
Okay.
So she's in her last year of preschool. So we are keeping her home. We have a quarantine pod a group of families that we've known, that we've all sort of collectively made the decision to keep our kids home and hire a teacher and do all of that kind of stuff.
Wow.
The reason why we made that decision is, one, we're all working moms, which I think is really cool in our crew. And we weren't sure that the schools would stay open or close, and we really need to focus on our jobs. And part of that ability to focus on our jobs is to make sure that our children are safe and taken care of. And it really throws off your schedule as parents if your kids are home and then the next day they go. So we decided that this would be a little bit more structured, and it would be like a committed 6 months. And then another aspect of that is my parents. And the numbers do show, it's not that no child can transmit it to an elderly person. It's not as much as adult to adult, healthcare workers getting a larger viral load and things of that nature. But for me, my parents are a huge part of our lives. We see them every single day. I work for my dad. And it wasn't a risk at this stage we were comfortable taking with the age of our kids. So, and I mean that for the listeners out there, because, if you have a kid that's 7th or 8th grade and you say, well, no, like my child really needs to go and learn, I don't know, algebra or whatever they're doing. And that's really important, as opposed to my 4-year-old who is learning how to read, but she can do that in 6 months as well.
Yeah, I think that's a really great takeaway, is that every situation is very unique.
Right.
And so just like there's not a cookie cutter way we treat even medical problems, blood pressure, cholesterol, we have to think about it in the context of the rest of the situation. That's really how I've been advising my patients about school.
Yeah.
It's if there's a at-risk person who's around all the time, and that's not a risk you're willing to take, that may be the decider. Whereas if you and your spouse live in a city away from all the grandparents and your child's in good health and you guys are in good health, then you may feel that,
absolutely,
because the truth is children can sometimes get sick from COVID. They typically don't get super sick the way that older adults do, but they can get sick. So,
and I think it's also with resources. I mean, we are so fortunate and lucky to be living in, an area in a city that has beautiful weather most of the time. We can have the kids play outside. We're fortunate enough, we have homes that the kids are homeschooling in, but, I have people that are work in my office or work in our home and patients that literally, there are 3 children that are homeschooling that are 10, 13, 15 years old in a 1-bedroom apartment. Right. And they're all, fighting each other
maybe
for
with
space.
One screen for virtual learning.
And so, I would never judge and I would even recommend that family to take the option of school if you can, because as long as you're being safe, those kids are old enough they can mask. You can, mitigate your risk with elderly people. And so every family really needs to think about what their resources are, what their exposures are, and how, and the age in this, every age child, my 2-year-old doesn't even need to go to school. She's learning so much from her older sister.
Yeah. And I think if a kid's old enough to put on pants and keep the pants on their whole day, they can put on a mask.
Right.
And they can keep it on.
I know. I mean, there are so many good masks, too, right?
There's so many good masks. Great. So, well, thank you so much for sharing your journey with us.
This was fun.
And it's a great reminder for all of us to always understand the journeys of females and respect it and be inspired by it. It's amazing. It's
when you see us in the white coat, tell us it's cute.
Yes.
We don't want to wear it, but we have to.
Yes, doctor.
We have to be careful. We will not tell a doctor in a white coat that's a female that they look nice in the white coat.
No, we won't.
No, don't. Yeah. Just say, hi, doctor.
Yes, hi, doctor.
Hi, doctor.
Yeah, exactly.
Thanks, guys.
Thank you for joining us. Thank you so much. All right, guys. Well, thank you for listening to episode 9. This is a good one.
That was a great episode.
Yeah, I agree. A lot of cool pearls today. We learned a lot.
We finally learned enough about the nose. Should we just only talk about the nose?
Yeah, I think, okay, guys, just unsubscribe if you don't want to hear about the nose anymore.
If you want more nose talk, just go in those comments.
Yes.
When you're going to share the episode with your friends,
you got to send this one.
Just drop a comment about more noses, or if you want another part for us to talk about.
Absolutely, and please share, subscribe, like, listen, tell your friends to listen, because we are so excited about this. We have so many upcoming amazing episodes.
Big stuff. I can't believe how fast the show's growing.
I know. We want more guests.
Listeners.
I know. Go through and listen to episodes that you missed, because we are talking about some cool stuff, and we're excited to continue this journey.
Enjoy.
Thanks, guys.